Thank you. Hello, everyone, and welcome. This is Kelly Musoke, and I'm the Director of Education at the Curry International Tuberculosis Center. Today we have over 500 participants joining us from across the United States, and you should be able to see a participant list on your screen, though there are also many groups logged in, so the number of participants is significantly higher. So we're pleased to be offering the Affordable Care Act and Tuberculosis Control Navigating New Territory webinar. Today's session is being recorded, and we plan to post the recording on our website in the near future for your use. You have all been placed on mute in order to preserve the quality of the recording, and for this reason, we ask that you reserve all questions and comments for the question and answer period, which will take place after all of the presentations. This webinar is produced by the Curry International Tuberculosis Center, located in Oakland, California. The Curry Center is one of 5 regional tuberculosis training and medical consultation centers in the country. The Curry Center currently covers jurisdictions in the Western region that include Washington State, Oregon, Idaho, California, Nevada, Utah, Colorado, Alaska, Hawaii, and the U.S. Pacific Island territories. This project was funded by the Centers for Disease Control and Prevention's Cooperative Agreement and is a project of the University of California, San Francisco. Each registered participant will be emailed an individual evaluation link which cannot be shared. And all of today's faculty members have signed a declaration of disclosure. It's now my pleasure to introduce our facilitator, speakers, and panelists for today's training. Dr. Lisa Chen is the Principal Investigator and Medical Director at Curry Center. She's also a Professor of Medicine in the Pulmonary and Critical Care Division at the University of California, San Francisco. Dr. Christine Ho is a Medical Officer with the Centers for Disease Control and Prevention, Division of Tuberculosis Elimination. Christine worked at the San Francisco TB Control before moving to Atlanta, and she is now taking the lead with DTBE related to how the Affordable Care Act will affect TB providers across the country. Dr. Julie Higashi is currently the TB Controller in San Francisco. She has taken an interest in the ACA as an opportunity for local TB programs to expand preventive TB services to the community. Over the last 3 years, she has been working with the Executive Committee of the California TB Controllers Association to organize programming at conferences and meetings to help local California programs learn about the limitations and opportunities for their programs in the ACA. She is also working together with the state of California and federal agencies to bring attention to improving support for preventive TB services. This work has led to resolutions by the American Medical Association, the American Thoracic Association, and the Advisory Council for the Elimination of TB, supporting inclusion of the diagnosis and treatment of TB as a preventive service. Tom Donahoe is an Associate Professor of Family Medicine at the David Geffen School of Medicine at UCLA. He is the Associate Director of the UCLA Center for Health Promotion and Disease Prevention and Director of the UCLA Pacific AIDS Education and Training Center. Over the past year, Tom has been leading national, regional, and local ACA implementation and strategic restructuring efforts for HRSA and CDC-funded organizations, focusing on the impact for HIV agencies, clinicians, and consumers. Naomi Seeler is an Associate Research Professor in the Department of Health Policy in the George Washington University School of Public Health and Health Services. She currently advises governmental, nonprofit, and foundation partners, including CDC's Division of TB Elimination, on opportunities and challenges under the Affordable Care Act, analyzing changes in eligibility, coverage, and cost sharing in Medicaid, Medicare, and private group and individual plans. Prior to joining GW, she served as counsel to Representative Henry Waxman in the U.S. House of Representatives for nearly 8 years. This included drafting and passage of the Affordable Care Act, and as counsel, she helped develop public health legislation, including the prevention and wellness provisions of the House version of the Health Reform Bill. And finally, we're very pleased to welcome Dr. John Bernardo, who is a professor of medicine and biochemistry at Boston University School of Medicine, and also the State Tuberculosis Control Officer at the Massachusetts Department of Public Health. As John likes to say, he has been living with affordable care in Massachusetts since 2006, when Romney was governor. Our learning objectives for this webinar are to describe how TB programs could strategically leverage opportunities presented by the Affordable Care Act to ensure TB services, and to list 3 steps that public health programs can take to assess the impact of the ACA implementation on clinic services for TB. And finally, here is our agenda. First, we're going to begin with Dr. Christine Ho, who's going to go over the impact of the Patient Protection and Affordable Care Act on TB control. That'll be followed by Dr. Julie Higashi, who's going to really go into detail on the local program perspective and what her program in San Francisco is experiencing and how they're preparing. And then finally, we'll hear from Tom Donahoe, who's going to give us some key information that your patients will need to know to enable you to help them navigate this system. And then finally, we'll have a conclusion question and answer period, and we'll have our panelists joining us then. So thank you. Now we'll begin with the first presentation, so I'll turn things over to Dr. Ho.